The vital need for the NHS to get on top of the sepsis scandal has been highlighted after health staff failed to recognize the deadly condition in a baby girl. "11-month-old Peggy Bradford almost died after she was turned away by a GP, and a hospital.Her distraught mother Emma said she was repeatedly told the infant had a virus and should go home. But the 28-year-old beautician woke in the early hours to find her daughter's skin had turned grey and her lips were blue and called 999. Peggy was taken to hospital, where doctors confirmed she had the potentially deadly condition sepsis.Mrs Bradford yesterday decided to speak out to warn other parents and said her baby would have died if it weren't for her mother's instinct that told her something was wrong. Hitting out at the catalogue of NHS blunders, she said, "If I'd listened to both my GP and hospital staff who were telling me my baby just had a virus, then she wouldn't be here now." "It's only because I knew that something was seriously wrong with her. No one would listen to me, and that is quite terrifying when you are convinced that your tiny baby is really ill." The Daily Mail's and the Sepsis Scandal campaign has battled to prevent needless deaths from the condition, which is notoriously difficult to diagnose. But it seems cases are still being missed despite a government-funded awareness campaign and tough new NHS rules designed to speed up diagnosis and treatment. Mrs Bradford took her daughter to her GP with a temperature on January 11, but claims her concerns were dismissed. She asked for a second opinion and was told to take her to Peterborough City Hospital. But nurses allegedly told her it was a virus and sent her home later that day with the painkiller Ibuprofen.It. Was only when her husband Craig, 31, a lorry driver, got up for work at 3:40 a.m. the next day and turned their bedroom light on that Mrs. Bradford saw how poorly Peggy was and called for an ambulance. The baby was taken back to hospital, where she was diagnosed with sepsis and given antibiotics just in time. Mrs Bradford, from Bourne, Lincolnshire, said, "It was terrifying to get the diagnosis, as I knew how life-threatening it could be. But thankfully she was able to have the treatment in time and has luckily made a full recovery. But it was thanks to my instinct. If I'd listened to the medical staff who sent us home, then my baby wouldn't be here now." Sepsis occurs when the body overreacts to an everyday infection or virus.It can be triggered by a chest infection, pneumonia or the flu. It can lead to organ failure and death, but can be treated with antibiotics if picked up in time. Figures out earlier this year showed the number of patients dying from sepsis in English hospitals has jumped by a third in 2 years. Researchers blamed overcrowded wards and staffing shortages. Despite her ordeal, Mrs. Bradford was full of praise for the paramedics and fantastic nurses who treated Peggy. "But it should never have come to that," she said. The family have now lodged a formal complaint with Peterborough City Hospital. Mrs Bradford said, "I am quite a confident person and felt able to ask for a second opinion. But others may not feel able. I want to raise awareness if it means just one other mother has the confidence to trust her instincts." Sepsis, the leading cause of avoidable deaths in Britain, kills at least 44,000 people a year. The Mail launched its campaign in 2016 following the tragic case of 1-year-old William Mead. He died from sepsis in Trellisk Hospital, near Truro in Cornwall, after GPs and other staff missed the warning signs. Leslie Crosby, deputy chief nurse at North West Anglia NHS Foundation Trust, said the complaint was being investigated. "We can also provide absolute assurance that our organization is focused upon sepsis recognition, treatment, and prevention," she said.